You're back at the Faculty Factory podcast. I'm Kim Skorupski here at Hopkins looking at Dr. Anna Handorf. Good morning, Anna.
Good morning. Thank you so much for inviting me. I'm happy to be here.
Dr. Anna Handorf, MD, is currently the director of TinyTalks in the Department of Pediatrics and Peter L. Slavin, MD, Academy for Applied Learning in Healthcare at Massachusetts General Hospital. And Dr. Handorf is an instructor in the Department of Pediatrics, Harvard Medical School in Boston, Massachusetts, and a pediatric hospitalist in the Department of Pediatrics at Newton Wellesley Hospital in Newton, Massachusetts. She was a medical education research fellow at Mass General Hospital and Harvard Medical School in Boston when she wrote an amazing article that came out in Academic Medicine. And it was just, I think it hit the books or hit the press March 25th, 2024. The title is Let's Talk About It. Introducing the TinyTalks Curriculum, a paradigm for short virtual chalk talks. I read this article. I think I was running around my basement screaming. I'm like, yes, this is it. This is the answer. This is the answer. Dr. Anna Handorf is a health professions education researcher. She's a genius. She's here to talk to us about this paper and walk us through it. So again, Anna, welcome. Thank you. Congrats on the paper, on the idea. Before we get into TinyTalks, can you tell us why you came up with this, or what precipitated the invention of TinyTalks?
Absolutely. Hi, Kim. It's so nice to be here. Thanks again for having me. And thank you for that great question. I think that the reason I came up with TinyTalks was because as a resident, I realized that the resident schedule isn't necessarily conducive to attending all of the educational sessions that are offered by the program. When I graduated, I realized I think I only attended one lecture on EKGs. And it's not that there weren't more lectures available on EKGs. They just were scheduled when I was on vacation or on nights or post call or sometime when I wasn't able to attend. And I think some programs will say, well, if we record the 1 hour lectures, might you watch those? The answer is, as a busy resident, you don't have the time, you're tired, you're exhausted, you're already working so many hours. That didn't feel like a really great option. And so I thought to myself, how could we distill these 1 hour lectures into something that's really short, hits the key points, and allows you to kind of have access no matter what rotation you're on. And it also works, right? If you're on an elective and let's say you're on the pediatric infectious disease elective, and I was on with one of the amazing pediatric infectious disease doctors who is the expert in Lyme. I hear his great Lyme talk, but I missed out on the other pediatric infectious disease doctor who gives the great talk on TB. And so how can we really make it kind of establish some equality, I guess, and equity in the education that we're getting, no matter who you're working with or what patients you see?
Again, necessity is the mother of all invention. I love that idea that when you come upon something that like, this isn't working out, rather than going, that's a shame, saying, wait a minute, how can we fix this? How can we make this better? And Anne, I was just sharing with you that that's how I came up with this podcast. When I was at our AAMC, the Association of American Medical Colleges Group on Faculty Affairs, our annual conference. I think I was literally at the sink in the restroom, washing my hands next to somebody going, oh my gosh, Anne Brown, it's great to see you. Let's chat. And, she's running to a session. I'm running to a session. We've got a meeting. We've got a poster session later on. Then there's a reception. There's all this stuff, busy. And there's so many people you'd love to connect with. But it's one of those things, we'll touch base later, and you never do. So I'm like, we need a platform to have deeper conversations, but that other people will kind of like to creep in on and learn from those conversations. So that's when the podcast came up. So I love, Anna Handorf, that you're sharing with us, first of all, how you came up with this idea and that there was a gap, there was a need, and you found a way to fill it. So thank you. And can you just tell us about this again? Let's talk about it. Introducing the TinyTalks Curriculum, a paradigm for short virtual chalk talks.
Absolutely. So kind of thinking about once I had the idea, I was really lucky to be entering a fellowship in medical education. So I had time and dedicated time to be able to work on something like this, which I think is, you can use your free time, but that always seems to be limited. So I was really lucky to have support from both the Department of Pediatrics and the Learning Lab, now called the Slavin Academy at Mass General, to do this. And so I really went to the literature to say, if we wanted to really distill these 1 hour long talks into something shorter, can we find some evidence? Can we look to the literature to find something that would support this? So I did a literature review and found several different theories that really kind of fit the bill. I found that e-learning, we learned during the pandemic firsthand, and also in the literature, that it's a really important way that we can distribute education more equitably. And so really wanted to kind of use e-learning, and so being in the virtual setting, to make this a possibility. And I also kind of looked at, I did a needs assessment of the residents in our program and said, what type of learning sessions would they want? And Chalk Talks kind of came up amongst the residents as something that they really love. Chalk Talks are something that we use when you're on rounds often, right? You pull out a piece of paper, or you go to a whiteboard, or in the ICU, you might draw on a glass door, and you're able to have just like a short distilled chunk of time to kind of get across a couple of pearls that are really pertinent and in the moment. And so I looked into the existing literature on Chalk Talks, as well as cognitive load theory, the cognitive theory of multimedia learning, principles of adult learning. I won't kind of go into all of those, but kind of looked at all these things and came up with this concept of TinyTalks. The ground rules that we came up for, that we outline in the paper, are: 1, all TinyTalks must identify a category, and we came up with 3 different categories: approach to, explanation of, or application of, to really clarify the focus of the topic. And the reason we did this is because if you're going to a lecture on pain management, this happened to me when I was mentoring a resident earlier this year. I went in saying, like, great, I haven't really thought about the different receptors that pain medications interact with. This will be a really great review. But the talk actually turned out to be something about the biopsychosocial factors that impact pain, which was an amazing talk. And I still learned so much, but was not what I was anticipating when I first got to the talk. And so if the title had been Approach to the Biopsychosocial Factors that Impact Pain, I would be there ready to learn and ready to participate right off the bat, rather than it taking me a couple of minutes to kind of get into it and realize which direction we were going. So we really wanted to allow residents or any learners to kind of open up and know exactly what they're going into. So is this the approach to, diagnosing hypernatremia, or is this an explanation of how you treat it, right? There are different kind of factors within each larger topic, and making sure that residents or learners are going to the exact topic that they want was really important to us.
That is a pearl in and of itself, in terms of how we present our work and how we come up with titles that help organize our thinking and help organize the paper, the grant, the talk, whatever, is organizing ourselves under a conceptual domain that is broad, and then a title that's very specific. That in and of itself is very, very great advice, good advice. I mean, I love it. Thank you.
Oh, thank you. Our second rule is that all TinyTalks must be less than 7 minutes, and all material should be presented on one virtual chalkboard screen. Again, the one virtual chalkboard screen was trying to mimic the chalk talk that you might have in person, where you only have one small piece of paper, one whiteboard, one door in the ICU that you're writing on. And it also allows you to take a picture at the end of the lecture, at the end of the session, and kind of take that away with you as a visual abstract or notes that will remind you of what you talked about.
Okay. So I didn't realize that. I didn't realize that from start to finish, from minute 1 to minute 7, everything is fitting squished on one screen sticky note, if you will. So
yes,
it's
exactly
like a small PowerPoint, like only 7 slides, or no, it's one little picture.
One slide.
Again, genius. Genius. You're not up there like at a conference where you're using your phone and taking pictures, 15 pictures of somebody's screenshot of their slide. It's literally one thing. Oh, okay.
Yes. one slide. And I think that the learners love having the one slide. And many of them have said in our interviews with them that they actually screenshot it and they save it in their phones and they pull it back up. And then that jogs their memory and they remember the whole talk based on just looking at that. We call it the storyboard, which is really kind of the purpose. And when I was envisioning this, that's what I wanted. I was like, we have so much information, but doesn't all need to be written down. You can say things and not write it down, but just keeping it really concise, I think, is really important.
Storyboard. So, so smart. How many times have we all gone to these talks or listening on Zoom and we have these multiple screenshots and notes here and there and everything's higgledy-piggledy. And that's the problem with like the information overload. It's out there somewhere. But by the time I think, where in my inbox was it in my Outlook? Is it in a file folder? On what drive? In my phone or on my device? Where is that thing or those things? One screenshot that you sort and you can keep them all in an area and you could tag them. And then it's like your own little walking encyclopedia, your own little Rolodex of information. Oh, Anna Handorf.
Yes. And then part of that rule was also limiting it to 7 minutes. In the literature, there's some evidence to support 6 to 10 minutes is the best kind of duration for these short educational videos. And then based on that data and kind of talking to our trainees, we decided on the 7-minute mark. The part that I think is challenging for some of the teachers when they come in to create these talks is they think that they can, cover a whole entire topic in 7 minutes, and they quickly realize that 7 minutes goes away pretty quickly. And so we recommend using a technique called chunking, where you really break up a topic into a couple of different subtopics. And so you can really focus on a specific area. And that goes back to the title when you want to describe it as approach to, explanation of, or application of, you know exactly what you're opening. So for example, I created a 2 Tiny Talk series on anaphylaxis. I did approach to diagnosing anaphylaxis and then approach to managing anaphylaxis. And so if you already know how to diagnose anaphylaxis, but you're like, what actually do I need to treat with? You don't have to listen to that first Tiny Talk. You can just jump right into the treatment. Or if you're like, I'm not even at the treatment point, I don't know if this patient has anaphylaxis or not, let me open up something and just learn about the symptoms. You could just go to the first one.
So I love this, just the way that is so logical and sorted out versus having to go to a YouTube talk or a webinar and get your mouse on that little button and try to drag it to where somebody maybe was kind enough in the chat feature to go, if you really want to learn how to cook this darn recipe, go to minute 3.47 and you're trying to get to 347 to get to the recipe and cut out all the superfluous stuff. That's so smart. So smart. I just love this. Keep going.
Oh, thank you. And then our third rule, we mentioned we had those 3 rules. So the third one is that all Tiny Talk videos should use the 3-step approach, the hook, the frame, and the delivery, which helps guide the creation of the video. And so this was really me pulling together a lot of existing literature on how to make a good chalk talk. But basically, we want teachers to create a teaching script or an organizational framework for the material that they'll be presenting. And that includes having an introduction or a hook or something that's an exciting opener that's going to really grab their attention and activate prior knowledge. And that really helps learners anchor on the new information to come once they kind of are excited and realize why it's important. And then we kind of go into the frame, which defines boundaries, provides structures, and helps to identify the level of expertise that a learner is going to bring to the topic. And so we recommend using SMART objectives. So I'm sure your listeners are familiar with SMART objectives: specific, measurable, achievable, relevant, and time-based. And we recommend limiting it to only 1 to 3. Sometimes we have 4 objectives, but really to keep it in that 7-minute time frame, you want to make sure that it's pretty limited.
Well, Anna, so I just want to take a moment here and stop before I start rambling on. But rule 1, all Tiny Talks must identify a category, approach to, explanation of, or application of, to clarify the focus. Rule 2, all Tiny Talk videos must be less than 7 minutes with all material presented on one virtual chalkboard screen, hence your storyboard. Rule 3, all videos should use a 3-step approach: a hook, a frame, and a delivery, which guides the creation of the video. Okay, so not only is this so elegant and beautifully organized for the learner, I can't even imagine the impact on the teacher, the instructor, because you just said something really important earlier on, that a lot of people think that I can just do this really quickly and I'll just talk. Even so, someone said to me, Kim, can you give your WAGs, your writing accountability groups, can you give your WAGs talk? I'm like, sure, how long do I have? It's like I can do an hour and a half thing or a half an hour thing. I just talk faster. So no, that's not the sense that you just talk 2.0 speed to jam all that stuff in a condensed time. It really focuses us as the teacher to, again, back to your title, being very, very crystal clear. Like when we're writing grants, all the C's, the five, clear, concise, compelling, coherent. And I can't remember the other C, but it really makes us better teachers, I think, when you are using this framework to distill the goal. What is the purpose of this tiny talk? And be honing in very clearly and getting all that other noise that kind of takes us down trails and little pathways. Not to say that's not good. Sometimes if you have that kind of day to meander around, and that's very, very important. But I think not only is this incredibly, just so valuable to the learner, but I'm thinking from the instructor, what kind of feedback do you get from your instructors? I know I'm in the article, you talk about how long, we'll get to the later stuff later on about how long it takes to do these things, but what kind of anecdotal testimonial evidence have you heard from the instructors who have created this? How has it affected them?
Yeah, so it's I love that question, and we're actually studying the Tiny Talk experience both from the learner perspective as well as from the teacher perspective. And I was doing semi-structured interviews with the teachers, and so I was able to get a lot of information from them and their experience. And by and large, the teachers have really loved it. And it's really heartwarming to me to hear all the amazing feedback they give. But so many of them say that it really helped them feel like they were able to better hone in on what they really wanted to teach and the pearls that they really want to make sure that they pass on. And a lot of them, I forget exactly the quote, but if I had more time, I would have written a shorter letter. I think that people think, 7 minutes, I can do this in absolutely no time. But it actually takes some time to really whittle it down and make sure that every word you're using matters, because you only have 7 minutes. And once you do your hook, that's usually about 30 seconds. We also ask for take-home points at the end. That's probably another 30 seconds. And so, you're really left with 5 to 6 minutes of actual content in the middle there. And so people have said they loved learning kind of the theory behind making a chalk talk, but more importantly, they feel like they can take these lessons to other teaching areas, not just in chalk talks. So I had one teacher say that the next time he gives a grand rounds, he wants to make sure that he uses some of these principles of really making sure that he starts with his objectives, makes sure that everything that's in the talk relates back to those objectives, and then comes back with the learning points, the take-home points that are the most important. And you can, tiny talks are not the best for all learning scenarios. You do need to have longer learning sessions, of course, and you need to be able to have more information than that can just fit in 5 to 7 minutes. But I think that this is a really nice way to just help you really crystallize what's important, and those practices can go into other areas, even if they are a longer form.
Anna, I really appreciated that quote. If I had had more time, I would have written a shorter letter. And that's the paradox, is that it does take time to, as you said so nicely, crystallize thoughts. And I suffer from this criticism, well, not criticize, suffer from criticism. Well, I do suffer from criticism, but I have this challenge of whenever I get in front of a group and want to teach a leadership course, I have so much stuff in my head and in my life now, being almost 60 years old. And one of my top Clifton strengths, my first one actually, is input. I'm all about input. I feel like I must impart everything that is to be known on a topic. And that overload is in my brain, and I feel like I have to just fire hose at the learners, and it's just too much. And so the responses I will get, and the evaluation I will get, is like, it's just too much. We didn't have time to do all that stuff. And so the irony is that you think, but I have this precious time with you, I really want to give you everything I possibly have, when in fact, pulling back. I was just listening to my favorite, the only podcast I listen to, Hidden Brain, where Chakra Vedanta says just did one on Friday about doing less. And this one researcher was talking about, I found that I was better when I did less, when I studied less, when I prepared less, I was actually performing better. So I think that this is this idea of your model and how you pointed out nicely for grand rounds really is evidence that on figuring out what you want to do and realizing and being confident and okay with these three nuggets, these pearls. This is great. This is all that has to happen. I don't need to cram 175 pearls into the faces of these learners. That's not, in fact, people will shut down with that. So
exactly.
So many implications of making the teacher better teachers and the learners really have some solid foundation and then enthusiasm and inspiration to continue going, because now they're like, okay, I got it. I got these things. Yep. These three things. Next, bring it on.
And what's so nice from the learner perspective is they say it really levels the playing field, because they watch a Tiny Talk, they get those 3 points, and then they can go to their attending and say, hey, I watched the Tiny Talk. I know these 3 things, but this case is a little bit different. It doesn't fit this mold. Can we talk about the nuance about this particular patient, knowing that I have the same starting point? It's kind of like levels the playing field in that way. And it allows, then you can, if you're calling a consult, you could say, hey, I watched your Tiny Talk. This is what I think I want to do. You're the expert. I wanted to confirm with you that this is what you would do in this particular case with these, particular conditions that might be a little bit different than standard.
Fantastic. You're changing education as we know it, Dr. Anna Handorf. I love. All right. So let's get to the nitty gritty. Right now, as I understand it, these are in the firewall currently. And but before we get to like what kind of teaser we have for the public here, this is not something like, as you kind of implied or intimated earlier, this is not something you do on the fly. In your paper, in the article, you talk about how long it takes to create and produce, editorialize, and edit these things, these talks. It's not an insignificant amount of time. I mean, on average, it was about 207 minutes for the teacher, which is about almost 3.5 hours. And then to edit it, 188 minutes is about 3 hours. So this is an investment, but, so I want to say the but. So the caveat is, this is not something, 7 minutes, I can whip this out in 20 minutes. No, there's steps to this. And it's almost kind of like I'm anticipating people go, I don't have the time to do this. That's right. Yeah, we don't have the time to train people who come to work for us. But guess what? If you don't spend the time on it now, you'll spend time later when people make mistakes or when you have to redo that talk. There's an enduring component. There's something that is enduring of this product. So the investment of time not only pays off with this legacy of this work that will live out there forever or for a long time, but it also embeds that new process, that way of streamlining and finessing and improving our skills as instructors. So can you talk a little bit about the operations of how it gets done, and then maybe like how other people can take advantage of this and play in this Tiny Talks sandbox?
Absolutely. So you did quote, I think about 3 hours was the time it takes a teacher to make a Tiny Talk. And that is true. And there are a couple of caveats. The first is we have continued to make Tiny Talks since the paper is out. And so we've continued to look at the data. And we've also looked at how long it takes a first-time teacher versus how long it takes when people make subsequent ones. And it does get faster when you have made them before, because you're a little bit more familiar with the process. The process itself also has some inherent time baked into it. And so to make sure that all teachers understand our process, we have them watch Tiny Talks, the Tiny Talks teacher training series, which is a series of 5 videos that I created in the Tiny Talk format that kind of gives them an overview and orientation to how to create a Tiny Talk. So we have a video that kind of welcomes them to Tiny Talks and talks about why we made Tiny Talks, what Chalk Talks are, what they'll expect in the process. We then have one about how to select a Tiny Talk. We have a topic. We then have one about how to create the Tiny Talk teaching script, which is using that hook, frame, and delivery model that we talked about earlier. We also have one about how to create a Tiny Talk storyboard, and we give them tips for actually creating that one-page chalkboard slide. And then we have one about where we talk about how we put it all together and bring technology into the mix. And so that training series is about 30 minutes, and it's in 5 to 7 minute chunks. And so you don't have to watch it all at one time. And teachers have said that they like that flexibility to be able to watch one and then, watch the intro and then say like, okay, what am I going to do? They watch the topic selection Tiny Talk, and then they're able to say, okay, based on these tips, I'm going to pick this topic. They run it by me, and then they watch the how to make a teaching script in the storyboard one. And then they will independently work on creating their Tiny Talk based on the topic and kind of following the advice that we give in the teaching script and storyboard. And then another interesting, I think, unique element of Tiny Talks is we actually have a dress rehearsal process where before we record the Tiny Talk, we make sure that there are end learners. So the pediatric residents will come and watch, typically it's over Zoom, the teacher give a dress rehearsal of their Tiny Talk. And the point here is to make sure that we're able to ensure that the content is targeted to the learners in the right way, right? One of the amazing things about in-person Chalk Talks is that there's a lot of give and take back and forth between the person giving the Chalk Talk and the learners. And that kind of gets taken out of the format when it's virtual. And so doing this dress rehearsal, residents can say, hey, I'm not really sure what you meant by X, Y, or Z. Could you elaborate on that a little bit? Or actually, I already know, I think we all know what A, B, and C is, so you don't have to spend as much time there. And it makes sure that it's really tailored to the level of our learners. We also have some residents, one of the first Tiny Talks, we went through a dress rehearsal, and the resident said, all this information is fabulous. It's just not presented in the way that I think about it. Can we just fully flip the order? And that's how I think through this topic. And so the teacher was able to do it. It turned out to be one of the most highly viewed Tiny Talks that we have. So it really allows for a lot of great feedback to make sure it's a great video.
Gosh, Anna, another amazing insight. I'm learning so much from you, because I don't care how many times I've been told throughout my life to, when you're preparing a talk, do a dress rehearsal with I have never, I don't think ever in my life had a family member or a friend or a colleague, like, I'm going to give a talk at the national blah, blah, blah. Can I give it to you? I've never done that, probably because I'm this off the charts extrovert, and I have no problem talking to 10 people or 1,000 people. But maybe it's also this arrogance of like, I got this. They told me how long I need to spend on this. I can do this. But wow. What real time, immediate, incredibly rich feedback from the ultimate end users. So to be humble and to put yourself out there and to have the learners give that feedback to make sure that what you're going to do is even better. I mean, that's just so smart that you have that baked in. That's so great. Well, tell us also about your resident Tiny Talker. How does that resident Tiny Talker, you have another little cool component here.
We do. So we have an army, basically, a group of residents here at Mass General who have signed up to be resident Tiny Talkers. And so I've onboarded them. So they watch the same Tiny Talk teacher training series so that they understand the process through which the teachers create a Tiny Talk. And they commit to participating in these dress rehearsal sessions, obviously, when they're available. So if they're on awards rotation, I'm not going to tap them in, but I email out to residents that are on electives or more flexible rotations, and they will sign up to come and participate in this. And they have really enjoyed, I think, being part of the process. And I think it's helped them learn more about pediatric content, but also learn how to be a better teacher themselves. They are able to kind of flip that stereotypical role that they interact with teachers in. And I think we have a really amazing faculty. And I think that the faculty and the residents get along really well at our institution. But I think it helps bring people even closer when they're able to kind of flip that role and give feedback in a way that's not typically given. And my hope is that by practicing this in this setting, that maybe they'll feel more empowered to give feedback in real life, because as attendings, we want feedback. And I think sometimes residents feel uncomfortable to give feedback to someone who's quote unquote higher in the pecking order than they are. But I'm hoping that this might help embolden people.
Yeah, you're setting the culture. This is how we do things here. And if that becomes part of the culture, part of the expectation that faculty seek out feedback, because there's this excitement of, ooh, how can we make this better? There's certainly one thing I could do better. That's training everybody on both ends to, no, we're not skating through this. This is not just how you doing and a drive-by how you're doing. This is for real. I want a real answer. I want some real interaction. So it's totally changing the expectations and normalizing that kind of truly interactive, engaging learning. So I think it's fantastic. Anna, what I want to know, I'm sure we all want to know, how can the public engage with? Because all right, hang on a second. Footnote here. Okay, so before I get back to my question, I hope I don't forget it. Is I wanted to. If Lisa Bellini's listening to this at Penn, and I'll make sure she does, I'll send her the link. I'm trying to push precision faculty development for years now. About 8 years ago, Charlie Irvin and I in Vermont, he's from Vermont, we gave a talk at the Professional Development Conference for the AAMC GFA about precision faculty development. Martin Feeder and I, but even before that, we were noodling around what would be precision faculty development. How would we design, deliver, measure faculty development progress or outcomes on a one-to-one basis? How can you do it? I'm like, well, we do precision medicine, we do precision education. Why can't we do precision faculty development? Long story short, fast forwarding, Lisa and I have a manuscript that's being reviewed again for the umpteenth time. And part of that paper is describing a national repository or a warehouse, some way that we could house generic enough faculty development content, leadership, negotiation, communication, difficult conversations, conflict mediation, how to write papers, how to write grants, all that stuff that is, generic enough that we can all, as scientists and physicians, learn from that. And then, of course, the nuances would be tweaked. How to get promoted at your institution could be like an add-on to that. But anyway, I think this would be the TinyTalks platform dashboard model is the ideal way for all of us to contribute to this and amass this repository. So I think that my question to you is then so what are the next steps for you in terms of public accessibility, or how can we leverage this scaffolding and make it bigger? And maybe you also wanted to mention something about making it publicly available and everybody contributing it would be kind of roll back to consensus building, or how you decide, because I know you started the whole TinyTalks from the general pediatric certifying exam content. Mm-hmm. But if we're trying to do this writ large, in our paper, Lisa Bellini and I, we're proposing like a board, like a national board of people who are interested and love this stuff around the country would figure out what content should go in this. So maybe that's a lot of questions, I know, as usual in my big mouth. But how do you determine what content, and then what's the next step for normal folks like us to get involved?
Absolutely. I heard a couple of questions in there. I think one thing that you might be getting at, which is really exciting, is that we started out with pediatrics content, and then based on the positive reception we had at our institution, we actually have developed a second portal that is in the infancy stages, but we're definitely developing, which we call the Educator TinyTalks portal, and it's all about content about how to be a better educator. So we have a couple of videos that we've already created thus far. So for example, we have approach to decreasing bias in written evaluations, approach to finding the teachable moment, explanation of benefits of a learning orientation or growth mindset, approach to written feedback, those types of questions that can be useful to anyone, right? Like that can be useful for faculty, that can be useful for staff, that could be useful for trainees. And so it's really exciting to be able to bring TinyTalks to a kind of different sphere, which is really exciting. And the way that we picked the content for the topics for both the educator series and for the pediatrics content is we're actually using a series of consensus methodology panels. We use a modified nominal group technique, which is a way to develop consensus. And it's basically you get a panel of typically 5 to 8 people in a division. And we like to make sure that it's interdisciplinary. So we have MDs, dietitians, nurses, respiratory therapists, et cetera, that all come together from, let's say, the neonatal ICU. And we pose the question, what discrete topics and skills are most essential for pediatric residents to learn when they rotate through the neonatal intensive care unit. And we go through the steps of the modified NGT and come up with a list of curricular priorities that are prioritized from the most important to the least important. And then we actually use those to guide the creation of the Tiny Talks. And then we also did a needs assessment, I think I mentioned. So we have some input from the residents there. We look at the content outline for the American Board of Pediatrics board exam. So we have a little bit of input from there, but kind of using all of those things together is how we have come up with our content, which has really been a fun process.
Yeah, and that would just be that model, that process would work well on a larger scale for competencies around leadership competencies or competence for becoming an NIH funded or other funded investigator, for building your clinical practice. There are established competencies that this national board, if you will, could come up with, and then could propose or their Tiny Talks that would be added to that curriculum. And it could be free and it's accessible. Like you said, it levels the playing field. It's all about equity and inclusion. And I think this is Anna Handorf is leading the future. All right. So how can we play in this?
And next steps. Yes, that was the last part of that question. So right now, all of Tiny Talks, they are behind the firewall at our institution. In large part, that's because we've been wanting to study them. And so look at the efficacy of Tiny Talks. And in order to do that, part of the thing we do is looking at views and the number of hits we get and the different interventions that we use to see how effective that is. So it's all behind the firewall right now, but I am working with many of the different divisions, departments, entities at Mass General Brigham to see if we can make this more publicly available in the future. So fingers crossed, this will be something that will be accessible in the future.
It absolutely will. We'll make sure this happens. Anybody listening to this at Harvard, come on now, play along. Here we go. Let's make it happen. Whew. Dr. Anna Handorf, I can barely sit still. I'm so excited. I'm so proud of you. I'm so amazed by this work. And this was not easy. This took a lot. It definitely demonstrates your strengths as a convener, a collaborator, teamwork. You really have exemplified that kind of broad reach of bringing all the wisdom and working together. So I love it so much. Folks, if you want to get in touch with Dr. Anna Handorf, she's on formerly Twitter, it's X, it's at Anna Handorf, ANNAHANDORF. You can email her at ahandorf, AHANDORF, at mgh.harvard.edu. We're going to link to her, not only her email address, but we're going to link this amazing article, Let's Talk About It, on the website. And gosh, we're going to have to get her back here when she could do the drum roll and make the grand announcement that we can all start Tiny Talking. I'll give you the final word today, Anna.
Sure. Thank you so much, Kim. Well, first of all, I just want to thank you for inviting me to be here. This is really exciting. And it's so exciting to see someone else as so enthusiastic about this as I am. And to your last point, I think that it would be remiss if I did not thank the huge community of collaborators I have behind me. I could not have done this alone. And so, to my institution, the Department of Pediatrics at Mass General, as well as the Slavin Academy at Mass General, I am so grateful for the time and support that they have given me. And also to all the faculty and the resident Tiny Talkers that I'm not the teacher, right? And so I'm kind of coaching everyone through, and I absolutely love being the coach, but this wouldn't happen if we didn't have the amazing expert teachers as well as the residents. And then we have a board of directors, our core Tiny Talkers, who I am so grateful to have in my corner. Dr. Ariel Freivogel is my mentor, and she has always been cheering me on. So I want to give a special shout out to Dr. Ariel Freivogel and also Dr. Mike Healy, who has been one of the my right-hand person as well throughout this process. So huge thank you to everyone that has made Tiny Talks what it is today, and hopefully allowing it to continue to grow into the future.
Hello everyone, it's your podcast producer Casey Calnan. Please make sure to download for free our newest Faculty Factory book, the Academic Medicine Starter Kit, Timeless Tips and Guidance for Early Career Faculty Members. More information on that is available on the facultyfactory.org homepage. In addition to that, I wanted to let you know that as of June 2024, this podcast has had more than 85,000 total downloads and roughly 11,000 total YouTube views. And in addition to that, the Faculty Factory website has drawn 46,000 web visits from users in 122 countries. And we're inviting you to be a guest on our show. Please reach out if you'd like to be a guest or to nominate someone in our academic medicine community that you think we need to hear from. Visit us on facultyfactory.org and drop us a message there.
Thanks for tuning in to Faculty Factory Podcast. The mission of the Faculty Factory is to build and support a community of leaders in faculty development who share tools, resources, wisdom, and encouragement in service to our faculty members, schools, and institutions. We encourage you to go to facultyfactory.org to find out more, get in touch with me, ask me any questions. Maybe you want to be interviewed on the podcast. Thanks for tuning in to Faculty Factory Podcast. We'll see you next time. The Faculty Factory podcast and website is sponsored by the Johns Hopkins University School of Medicine Office of Faculty. For more information, visit facultyfactory.org.